What is gender-affirming care? A person's gender is one's innate developmental sense of self as female, male, both, or neither. Many factors influence the neurological circuits that create this self-perception. A person's gender is distinct from genotype, phenotype, and expression. In Western societies, gender was historically thought to be made up of two opposing categories, female and male. This is called the gender binary. But other genders have long existed, and this is increasingly recognized in contemporary research literature. At birth, a baby is assumed to be a boy or a girl based on their genitals. This is called assigned sex at birth. When a person's assigned sex at birth is the same as their gender, they are cisgender. When a person's assigned sex at birth is different than their gender, they are transgender. In this module, the terms trans and gender diverse refer inclusively to everyone whose gender differs from the sex they were assigned at birth. Language changes over time, and terminology that was once considered respectful gets replaced with more nuanced or considerate terms. Being responsive to the evolution of language is a fundamental part of caring for gender-diverse patients. When it comes to healthcare, gender-diverse people are an underserved population. As a result, they experience significant health disparities, including higher rates of poverty, homelessness, unemployment, depression, and substance use. A Canadian study found that over 11% of the general population reported that they have seriously considered suicide in their lifetime, and 3.8% have attempted suicide. For the gender-diverse population, the numbers are significantly higher. 77% have considered it, and 43% reported having attempted suicide. 21% avoided healthcare due to fears of being mistreated as a gender-diverse person. As a primary care provider, you are well positioned to address these disparities and improve outcomes for gender-diverse patients. When a clinician acknowledges and respects a patient's gender and supports them to access relevant care, it is called gender-affirming care. Gender-affirming care includes having basic knowledge about medical and surgical interventions, considering the ways gender-diverse patients might be vulnerable to health and social disparities, using considerate and inclusive language, and updating clinics, forms, resources, and practice tools to ensure they are gender inclusive. This course will help you incorporate gender-affirming care into your practice. At Transcare BC, we are committed to working with community members and healthcare professionals to ensure that gender-diverse people can access gender-affirming healthcare in their home communities across British Columbia.